Today I want to talk a few minutes about how to stop smoking. Some medications to stop smoking. First of all, I always encourage people through counseling. First give counseling, then the medications. You have to use one or the other, sometimes both. There are good referral services. There is a free telephone quit line, 800 quit now in the United States. You can use that as a source. There are also free web-based and text messaging cessation support. You can go to website smokefree.gov. These are some good options for counseling, especially office-based behavior over support. When it is not available, you can always refer people to these websites. Now, first-line medications for smoking cessation include nicotine replacement therapy, also varenicline, known as Chantix commonly, and then there is bupropion, known as Wellbutrin. So these are the three medications I usually use for my patients. So first you give counseling, then you take full history, because certain medications should not be used. Bupropion, for example, is contraindicated in patients who have seizures and other comorbidities. So the choice of the agent is always depends on the patient. So you have to discuss that. For most patients, you can start with varenicline or a combination of nicotine replacement products like a nicotine patch or a nicotine gum or nicotine lozenges. Bupropion or a nicotine patch, you can use these as alternatives to varenicline, because varenicline is a costly medication. And take a full history and talk to these people about the side effects they experience. So when you start a medication, you need to think about completely. Do you have any psychiatric illnesses, heart problems, lung problems, seizures, pregnancy, hospitalization? Or what is their commitment to smoking cessation? So once you establish this history, you go for the medications and how each medication is working. If you want to change a medication, talk to the patient, interview. If they say this medication is not working for me, increase the dose. If that is not working, add another medication or change medications. When people experience withdrawal effects, talk to them, counsel them, comfort them. So if a long-acting nicotine patch is not working, add short-acting nicotine treatments like lozenges and gums. So increase the dose when certain dose is not enough. So the first line medications, nicotine replacement therapy, is very, very important because it is also cost effective. So see the first 1 month and see how they are doing a nicotine replacement therapy. If that's not helping, switch to another medication. You can also switch to nortriptyline or Chantix, that is varenicline, or bupropion, that is Wellbutrin. So if you change these medications, many times you see success. Even patients will think you care about them. When they think they care about them, when you educate them, when you start these medications, they will definitely give you a try. So combination of drugs, they appear to be more effective than monotherapy, and they also can produce more side effects. So, but if a patient is not responding well to the first medication, you have to switch to a different medication. And many times people relapse. They stop and they go back to smoking. Don't get frustrated with them. Just encourage them again through counseling, and again encourage them to take medication. Again encourage them to start a nicotine patch or varenicline. But remember, always remember the complete health history. As I said, bupropion is contraindicated in patients with a seizure disorder or a predisposition to seizures. because bupropion, it reduces the seizure threshold. In many clinical trials, the risk was very low, like 0.1%, but still there is a risk. So you have to take a complete history. So remember that first give counseling and then medications. Nicotine replacement therapy, then varenicline, bupropion, nortriptyline. These agents should be used. And when you do that and educate people, definitely you will see success in smoking cessation.